Today we are going to discuss about gastric ulcers. These are the open sores or ulcers that form along the lining of the stomach or the small intestines. Generally, gastric ulcers are caused by two causes. One is either due to the bacterial infections and the other either due to the use of any drugs or long-term history of alcohol intake. So drugs like aspirin or other painkillers usage for long time will lead to gastric ulcer. Symptoms of gastric ulcers include epigastric pain, burning sensation in the epigastric region, and abdominal pain also. Long-term use of alcohol or long-term consumption of alcohol leads to bleeding gastric ulcers also. So to prevent these gastric ulcers, one need to maintain a healthy lifestyle and diet. This includes having fiber-rich diet, lot of veggies, vegetables, and other fruits also. Citrus fruits will also prevent information of gastric ulcers, and the stress is also sometimes a cause of gastric ulcers. So gastric ulcers need to be attended on time, and that for prevention is always better than who present with symptoms of epigastric pain or gastric ulcers can be evaluated by either endoscopy, and if after endoscopy if the ulcers are due to the cause of bacterial infections like H. pylori, they need to be treated with the antacids and antibacterial medication. And if the alcohol or other painkillers are the cause of gastric ulcers, they can be treated with PPAs, proton that is proton pump inhibitors. And certain liquids like even coffee or tea consumption will also elevate the risk of gastric ulcers these days. In my clinical experience, most of the patients presenting with gastric ulcers have the history of alcohol consumption, and especially the elderly people or the female population presenting to OP will have the history of long-term intake of oral painkillers or other medication like ecosprin or other drugs. So it's always in our experience, generally we always advise to use PPIs whenever we are advising in painkiller or the other medication which will cause gastric ulcers. And we encourage patients to promote a healthy lifestyle by adding fiber-rich food and citrus fruits and other vegetables, leafy vegetables in their diet, and to avoid caffeinated drinks, sodas and alcohol to prevent the risk of gastric ulcers. And bleeding gastric ulcers need to be attended on time with the support of a proper medical gastroenterologist. And whenever necessary, endoscopy is the best technique to diagnose gastric or intestinal ulcers.